It's now 1 month that you have been in practice, and now it's the time to analyze what happened. You have started a practice with a new thought process. You want to change a few things that were pre-existing so that you bring better efficiency. That's what we discussed last time. But now you have already finished a month. What has happened this month? Did the COVID disease behave well? Did you consistently go to your practice? Were you seeing patients practically every day? What kind of treatment protocols you could follow? What the patients thought about dentistry? Were they ready to do emergency as well as elective practice? All of this and related aspects of actual taking dental care will be more or less clear to you. It's very important at this point to also understand what was your turnover. How much percentage of a regular turnover was this? Because this is going to set up your next few months plan. I think the first month turnover uninterrupted, and when I say uninterrupted is because we don't know, maybe your area of clinical practice turns out to be a containment area suddenly and you have to stop again. These are going to be the challenges that we have to face, and again we'll have to reboot ourselves. So we come back to plan what we discussed the last time again. So unfortunately these are going to be the realities till we completely control the disease. If we analyze our practice and the fees that we made after the big break, and if it is around 25% of the average income that you were making before, I think you're on the right track. 25% should be the kind of collection you can expect for a practice which was running for a few years. I'm not very sure what will happen in a very new practice, for example, which only started 6 months before this lockdown period started, because that will be a challenging figure to estimate. Because you do not have so many patients who are going to come back to you, you're just kind of building patients there. You also need to do a quick SWOT analysis. S stands for strength. Find out what are your strengths in the last 1 month. What were your real strengths? Could you motivate the staff? Could you communicate well with your patients? Could you manage to make dentistry output better, efficient? Did you change your fees and started thinking of making it more profitable? Did you start thinking of adding value to your services and seeing that your patients understand the value? Did you manage to set up a very good infection control protocol, which probably had to be tweaked from what you were doing before? Understand that infection control protocols are constantly going to change, because all what you hear today is hypothesis. There is no evidence at all. COVID spreads through droplets. It spreads through contact, and it does not spread a lot with airborne, like an airborne infection. So when we talk about aerosols, which is airborne, we know that there is enough evidence that COVID actually does not spread as an airborne infection. However, people with COVID who were in ventilation therapy did throw a lot of organisms in a closed place in forms of aerosol, which were produced by the procedure. And that's the only reference we have. And we almost feel, because we have to treat all patients as if they are COVID positive, that every patient is going to do that in our office. Of course, we have to be careful. But I think the norms will keep changing and a lot of inputs will keep coming in constantly. And that's what you want to do now. You want to revisit all those norms. Try to change and tweak a few things which have happened so that you reduce your cost of your PPE and other things. You make yourself more profitable, but also be safe and not just get carried away by just buying more instruments and equipments and PPE kits which have no proven record. So look at the strengths you had in achieving a lot that you had to achieve, and of course you had some weaknesses. You failed in certain areas. What were those areas of failure? You could not motivate a particular staff. How do you want to correct it? Is it something in you that is not making you a real leader? So try to change your weaknesses, understand your weaknesses first, and then convert your weaknesses into strengths. Because the more we understand our weaknesses quickly in life, we become more successful because we can convert them into strengths. Also, we have several opportunities that we have, and those opportunities will be seen in the last 1 month. What were the opportunities? You saw 30 patients, you treated them well, you managed to give them relief of their symptoms of pain or whatever it was. You also spoke to them very well and tried to build better relationships. Of course, you did it in the past, now consciously, because you want them to refer people to you. You have started this as a new mantra for yourself. Try to understand that internal marketing is more important than external marketing. Do patients feel safe in your clinic? Do a little analysis. Improve those aspects as well. Revisit hygiene measures again. The last part is, what are the threats that you have faced in the last 1 month? Did one of your associate or as dental assistant have a small tragedy where he stayed? Was he again locked down because there was a calamity in his building? He was a very important person. Now he can't come to your clinic for 2 weeks because he's quarantined. That's a new threat for you because you just started your practice and suddenly this guy has disappeared now. He's going to only come back two weeks later once he is ruled out of having any infection. So what was your alternative plan? Could you manage to get somebody else in his place? Or you already had a backup? These are going to be constant things that we need to think from here onwards. Because as long as the disease stays, we are going to have challenges in every aspect of managing our practice. So I think this is a very good time, a 1 month period is a very good time to understand, because you have already gone through the whole thing and you have realized so many things that you could not imagine. Were you comfortable wearing those PPEs and working on the patient? How long did you have to put on the AC? How many times did you open your windows? Was it practically possible? It's summer season in India and it's going to be rains coming in next. We have weather challenges at this moment. How are we going to deal with it? Remember, today what I can look at literature and tell you is that after every patient, before every patient and after every patient, please not only wash your hands but also use a disinfectant. After the patient is taken away from the chair, clean the entire surface of the chair and everything else that is touched with 1% sodium hypochlorite solution, and give a pre-procedural mouthwash to the patient of hydrogen peroxide, 1%. So this would be a very good way of what I feel today, which we have to follow. We have to start all elective procedures, no matter what. emergency elective procedures, and I'm sure that the dental labs also will open as soon as dentists start opening clinics. A lot of people depend upon us, the dental manufacturers, the dental labs, and unless and until we deliver dentistry to the patient, the entire economic chain will not get geared up again. So the starting point is the dentist. And that's why it's very important for us to start elective procedures as well as soon as possible. We have to be very careful about controlling aerosols. There's no brainer in that. But most importantly, I think we need to schedule our appointment time to allow us to manage each day and each session of our work. My recommendations to you are also to revisit your clinic timings. I know some of you work from morning to afternoon and then take a break, work again in the evening. But in COVID times, you can follow COVID timings. Best is to do one session, not longer than 4 hours if possible, and finish maybe a maximum of 5 patients. If you have 2 chairs, you could do maybe 7 patients, and if you have enough room in the operatory and all the other logistics to be kept in place. But this would have already taken a month now, and now you're going to go to the next phase where you want to encourage more patient flow, more work output, and a much more synchronized system. And this is the time to start planning for the next few months as well. So the most important thing that the dentists need to understand is that everything that they do in their life is related to the time they spend to do a procedure. Imagine that you have 8 hours of work every day and you have about 20 days a month. So that means you have 160 hours of work that you can maximum have an output. I'm not considering the one-off holidays and other things. In 160 hours, you can almost do as many root canals. If you are doing a root canal 1 hour each and you are cut to cut with time, which is not possible. So maybe one dentist can do 100 root canals a month, and that could be the maximum limit. So your time-money ratio depends upon how much time you need to do a particular procedure. So if you multiply the fees that you will charge for a root canal, multiplied by the number of root canals you do a month, you will get a particular figure. And that could be what you could earn. The profitability for your clinic will come from there, and everything will be related to time. When we have 2 chairs, we have more time. We probably have assistants, we have associates who are working, and we can do more procedures. They may be less efficient than you, they might take more time, whatever it is. So it's important for you to now understand how your last month was, because you are rethinking on your strategies. What is the objective? You want to do everything quicker, more perfectly, with better results, and also creating value for the patient, and also charging a much better fee for yourself, and also profitability for your clinic. And all of these things have to be kept in mind. Continuing education, of course, is one of the ways to learn techniques, but continuing education not only related to dentistry itself, but also to practice management, also to understanding more about finance, time management, managing efficiency, all attributes which are essential to make you more successful. You also need to save time and build more efficiencies by ordering things online. And that is a very important behavioral change that you will have to adopt in the new era. Because the COVID thing is going to stay for 6 months, 8 months, 1 year, we do not know. We have to depend upon less human contact. So please do not think that somebody is going to give you 5% off because you have relationship with him. The truth is, he's giving you a service today and you're not even thinking about it, but tomorrow you're going to think about it. Because every time somebody comes to your office, you are going to get worried. Because COVID can make you stop your practice for the next 2 weeks. And that's dangerous. So you have to be mindful that that additional 5% discount is not worth taking. You rather would order things online and move as much away from human contact to save or the probability of getting disease in your office. You need to also start recalibrating at this time, because in the next 3 months you want to push yourself. You want to develop more efficiency as well as develop better patient output. You already now are on the path of improving yourself. COVID being the opportunity. So everybody is at a level field. So you need to also start thinking of talking to your bankers again, revisiting all of that. Start looking at your financial management, talking to your staff again, because you are, for the first 6 months, you're not going to be probably paying your staff the entire amount of money, because you will not have enough money to run the clinic. For some practices it could be 3 months, for some could be 6 months or even more. So you need to keep talking to everybody, discussing things with everybody, keep supporting them, and prepare yourself for the next 3 months, which is going to be most important, because you want to take your turnovers nearly back to what it was before COVID times. So start a unique internal marketing program whereby you reach out to as many patients as you can, tell them about your experience in the last month, and reassure them that everything is fine, everything is safe, and they should come for a checkup. Try to motivate them to come back to your clinic. Probably give them a free checkup, and this is all related to your own patients. Just call them for a checkup and start talking about oral hygiene measures to them. Probably they need some dental work, and you can always solicit more treatment as a part of your plan. But you start doing the entire thing again so that you can rebuild yourself in the next 3 months.